So this was a Moroccan multi-center study which evaluated the cost minimization of administering trastuzumab via intravenous versus subcutaneous routes in patients with HER2 positive breast cancer. Now, given that breast cancer is the most prevalent cancer among women in Morocco, to roughly around 40%, the study aimed to determine which administration route is more cost effective and logistically efficient in the local healthcare setting. This was a prospective observational multicenter study in which around 747 patients with histologically confirmed HER2 positive breast cancer were enrolled. And primary endpoint of the study was to compare the average total cost, which includes the drug cost, consumables, as well as consultation cost per patient for intravenous versus subcut trastuzumab. And secondary endpoint of the study was to evaluate the time spent in oncology units and management of drug-related adverse events. So in total, 747 patients from 3 sites in Morocco were enrolled between a period of March 2021 to July 2023. 379 patients received IV trastuzumab and 368 received subcutaneous trastuzumab. Both the groups, they were similar in terms of average age, weight, and cancer histology. Subcutaneous trastuzumab was preferred in EBC patients or early breast cancer patients and as monotherapy. While there was no clear trend for IV trastuzumab, subcutaneous trastuzumab was costing significantly more as compared to IV trastuzumab, to be precise, around 50%, 53%, and it was majorly driven by the drug cost. Total time which was spent in hospital, which includes for trastuzumab or chemotherapy administration, HCP time, as well as the admin time which is spent by the patient. In IV group, it was more compared to subcutaneous group, 220 minutes versus 163 minutes, while HCP time among patients where chemotherapy was given along with the trastuzumab, it was more with subcutaneous group as compared to IV. Now, there was no significant difference in terms of quality of life as was measured by EQD5 and treatment satisfaction questionnaire for medication. To conclude, we can say that IV trastuzumab was more cost effective with similar quality of life outcomes, making it a viable strategy for resource limited or constrained settings like Morocco. Now, IV trastuzumab is more cost effective in the Moroccan setting, as is seen in this study. Moreover, it gives freedom of adjusting the dose of patient as per the body weight. It can also, while sharing is also something which is possible. And weekly dosing is also feasible with IV trastuzumab. Subcutaneous trastuzumab definitely offers time savings, but at a higher cost. Now, both the routes, they offer comparable quality of life. This data supports budgetary planning and therapeutic strategy optimization for national cancer programs in favor of IV trastuzumab. I mean, there are certain questions, I think, which we need to ask, or the clinicians need to ask from themselves. They are like, how important is the shorter duration of subcutaneous trastuzumab in the real life setting? Will you prefer subcutaneous versus IV trastuzumab for administration with concomitant chemotherapy when the IV line is already there? Does vial sharing, which is possible with IV, does it matter in your setting or hospital? Do you prefer giving weekly regime of trastuzumab in some of your patients? And do you see any safety which is majorly the injection site reactions or immunogenicity, which can be more of anti-trastuzumab antibodies or against hyaluronidase. Any such differences between subcutaneous and IV trastuzumab formulations?